Hi, everyone, and welcome to the Anti-Doping Podcast, brought to you by the Partnership for Clean Competition. I'm your host, Dr. Marie McNeely, and today we are excited to be joined by our guest, Professor Andrea Petroczi. Listeners, Andrea is Professor of Public Health at Kingston University London, and she's also chair of the WADA Working Group on Doping Prevalence. And in our interview today, she is going to be speaking as an independent academic, not in her capacity as chair of the WADA Doping Prevalence Working Group. But Andrea has various areas of expertise in anti-doping, and today we are going to focus our conversation on doping prevalence, discussing research in the field, challenges, and opportunities. So, Andrea, welcome to the show today. How are you?
I'm very well. Thank you very much. I look forward to this discussion, and thank you very much for the invitation.
Well, we are so excited to have you with us today, but can you start by telling us a little bit more about yourself and what exactly you do in your role there at Kingston University London?
Well, as some might call me, I'm a career anti-doping researcher. I have been doing this since about 2000. So if I would be married to anti-doping research, I'm nearing silver jubilee soon.
I like it. Congratulations.
It started with my PhD. I chose doping as a topic for my PhD for all the wrong reasons. These reasons being, at that time, I had two very young children, both are in diapers. So I was looking for something that is quick and easy. So I was horribly wrong about both because it was neither quick or easy, but I completed the PhD. So the task was completed, but I stuck with anti-doping research ever since. At Kingston, my job is I'm a research professor, so I mainly do research, supervising PhD students. In addition, I'm also teaching a little bit in research design, research methodologies, and obviously I have a 5-week session on anti-doping.
Certainly. So what was it specifically about anti-doping that caught your attention, maybe as you were contemplating your PhD, and maybe what particular part of anti-doping got you interested?
Apart from the quick and easy part. I think I have to blame or thank one of my professors when I was doing my undergraduate degree in sports management, and my PhD was in sport management as well. So I'm coming initially from the organizational point of view rather than the individual. So I was interested in organizational behavior. And as a passing comment, he once mentioned, we talk about doping, probably in class settings, I don't exactly remember. He mentioned that it's the feature of the system because the more a system invests into sport performance, the more return on that investment becomes important. Therefore, the more organizations are willing to invest in, including doping, to make sure that there is a return on that investment. So I thought that was interesting. And I always felt that doping is not purely an individual choice. It's not just that there are bad athletes who want to win too badly. So I figured that that would be an interesting topic to do for my PhD. And obviously proving that it's a systematic issue is very, very difficult. So I went from the other direction. And I figured if I'm accounting for all the usual suspects, the attitudes, the wanted to win too much, the goal orientation, the competitiveness of the athlete, and I still cannot explain doping behavior fully, then it means that there is something else. There must be something else, which is the system or the environment, if you like. So this is what I did. This is what I started to do. And the results from my PhD was exactly what I expected. Goal orientations, win orientations, competitiveness, and attitude left a large part of doping behavior unexplained. Now, ironically, ever since I was labeled as the doping attitude researchers, and I think that the paper was misinterpreted in a large degree, but here we are. This is how I started.
Absolutely. And I think everyone's got a little bit of a different story of kind of how they got introduced to anti-doping, because it's not something that's necessarily a popular career path that people hear about when they're going through high school, for example. So then once you got your PhD, how did you find your way to this position at Kingston University London?
I did my PhD in America, and because I had young children and I was a single mother at that time, I wanted to come back to Europe. And there was a job at Kingston University right after graduation that offered me the position. So we decided to pack up and move to London. So I started in Kingston as a senior lecturer, mainly lecturing in management and sport management related subjects. And then slowly I started to build up my research in doping. So I started to progress in administrative roles. I went to principal lecturer. and so on. And then I decided that research is really what I'm interested in. So I moved sideways and started to progress on the research route from readership and then later on to professorship. And interestingly, because I started to move more and more to doing research at the individual level, try to understand the athlete's behavior. First, understanding, obviously, dopers is what makes some athletes to dope, then switch to what it feels like to be a clean athlete in this environment. So because I started to move more toward the individual level, I decided to do a second PhD, which I completed in Sheffield University while I was working as a professor at the same time. So it was quite interesting situation.
I think you're putting it mildly. That is an amazing accomplishment.
It was a good experience. I learned a lot.
Well, Andrea, you've done some really fascinating work, and I think your work in this area of prevalence is particularly interesting. This is a really interesting issue in the context of anti-doping. I know the term prevalence is often used in different fields, maybe epidemiology and others, but in the context of doping, I guess, what is prevalence? What is your operating definition, and why is it so important to know how prevalent doping is?
Well, the definition is exactly the same as in epidemiology, which refers to the proportion of the individuals within the population who have the condition or the trait, or in that case, who engage in doping behavior. Now, for the purpose of the project, we define doping behavior as the intentional use of prohibited substances and or methods. So it's exactly the same interpretation. It's expressed as a percentage. So essentially, it means what percentage of athletes in the athlete population are doping or engaged in doping-related behavior.
Absolutely. And I think it's interesting that you use the word intentionally, because I know there's this sort of context of, did people intend to take a particular supplement knowing that it had a contaminant or knowing that it contained a particular substance that's banned? Or in some cases, there's this unintentional doping. That can be really difficult to separate out.
I actually don't like the phrase unintentional doping because it's an oxymoron. It doesn't exist. Mm-hmm. Doping is defined from the psychological and behavioral point of view as the intentional, willful behavior. Then unintentional doping doesn't exist. Unintentional anti-doping rule violation exists, which covers the contamination, something that I'm not aware of but happened, and it actually causes a problem. But that's a very different behavior. It's maybe recklessness, but it's not intentional doping.
That makes sense.
Let me go back because I didn't answer the second part of your question, which I think is important, is why do we want to know the prevalence? There are two parts to that. One is we need to know the magnitude of the problem. And it's widely debated whether the doping prevalence is really that 1% that the anti-doping testing and rule violation sanctions indicate. Or is it higher? But if it is higher, then how much higher it is? So we need to know the magnitude of the problem. And the reason why we need to know that is because the different level of prevalence would call for different solutions. So if I can use a very topical example, COVID, we all remember what happened. The response to COVID cases is very different if we are talking about a few isolated cases, in which case the best approach is probably, epidemiologists might correct me, but it sounds like that the best approach probably is try to identify these individuals and isolate them as quickly as possible so they don't cause further problems. But if the prevalence of the spread of the virus or the disease in the population is 50% or higher, then isolating every single one is probably not a solution. So therefore, we have to have prevention, wearing masks, vaccination, and so on and so on. So doping is very similar because if it is really 1%, it calls for different approaches, both prevention and detection and sanction, than if it is 60% or 90%. So we need to know where we start from. And the other part is we need to have the ability to measure prevalence, because without that, we cannot assess what we are doing is whether it's effective or not. So we have to have the ability to monitor prevalence. It's not just a one-off. We need to know where we start from, but to be able to monitor over time to see if the changes are moving to the direction that we expect. This is the way we can assess the effectiveness of all the anti-doping measures we put in place, whether it is at the sport level or a country level or a global level. So to summarize what I just said is we need to have a baseline measure. We need to know where we start, but we also have to have the ability to monitor that over time continuously.
Absolutely. And I think because anti-doping is a global issue, being able to sort of benchmark and say, how is this area doing versus how is this country doing, and kind of know where people might need more help, I think is key too.
Yes. So that's why I really think it's an important project. It's timely or long overdue, but finally, I hope we are making some progress.
Absolutely. So let's get into the details of the methods then. How do you actually successfully measure prevalence? This is something where it's difficult to be able to talk to every athlete and get the exact correct answer of whether they're doping or not doping. How do you go about measuring it?
I would be very careful about this successfully. We are making progress, and I think it's a good progress, but it is a difficult task. And the reason why probably we haven't had a breakthrough just yet is not because there is a lack of will, which some of our academics might accuse us or WADA. It's not that simple as it seems. Partly because none of the indicators that we can use to assess prevalence are without limitations. So we have doping testing, which widely accepted. If we know it produces around 2% of adverse analytical findings, of which about half turn into a sanction at the end. So we are talking about 1% there. We also know, because there are some publications, that we can use athlete biological passport data to estimate the proportion of the prevalence within a sample without the need to identify the individuals. And then the third element that we worked on in the past 5 years is a survey-based methodology, because ultimately the athletes are the one who knew who are doing. And that's why it's important that I said we define doping as the deliberate, willful, and knowingly using prohibited substances. So ultimately, the athlete has the knowledge. It's just a question, can we create, a safe survey situation in which athletes would be willing to admit because there is absolutely no consequences to them? And two, what is the best way to motivate them and what motivates them, to be honest? Yes, we can make it safe, but we also have to convince them that they should tell us. So basically, we have these 3 different indicators. Every single one is coming with their own limitations, but what we work on as a working group is trying to combine these indicators into a single measure, sort of counterbalance the limitations. So individually, none of them are capable of producing an accurate picture, but we hope that collectively we will have at least a good indicators of the level of prevalence. It will not be a specific and a very precise percentage, but it will be a magnitude. Again, I'm using COVID example again. COVID helped us a lot in that sense. If you remember what happened in COVID, in every country, we used several pieces of information to assess the situation, which included the unfortunate death cases, included the positive test, included self-reported symptoms, included hospitalization. And we all combine all of these pieces of information to create a sort of traffic light system to see if we are in a green zone or an orange or a red zone. The red zone, obviously, the most severe measures because the situation was dangerous, and green zone was, yes, the virus might be present, but it doesn't cause much problem. So we try to do something very, very similar. So combining the different measures, the challenge there is because they are measured in a different way, we cannot just simply add them together and calculate an average. We have to find a way to combine them.
That makes sense. And you've touched on just a lot of the challenges that you've encountered in trying to measure prevalence, and particularly in the methodology. I guess if you had to summarize it, what are some of the biggest challenges that you think you're facing in the future as you try to wrap your arms around this big problem of doping prevalence and how to most accurately convey or provide these indicators for how programs are doing and how countries are doing?
Well, the challenge for the analytical indicators, which is the testing, is obviously the number of tests that would require for an accurate measure is impossible. The same goes for the athlete biological passport, because these are all expensive to collect, expensive to store, complicated to analyze. The cheapest option would be the survey, because technically there is no significantly increased cost by sampling every single one. But then it comes with a different logistical questions. So the challenge is that we have the pieces of information in the system, and then we know where we can generate more evidence. At the moment, we don't have the clear system of how to combine all of these together. We are working on that. We're developing a model within the working group. But to be able to populate that theoretical model with data, it essentially means that every stakeholders in the field, international federations and anti-doping organizations and major sport event organizers, has to be on board to provide the data or provide access to collect the data. So I think the biggest challenge is who is going to coordinate and bring all of that together, and who's able to fund all of that work at the end.
Absolutely. And Andrea, you mentioned a couple times this WADA Working Group that you're a part of. So can you tell us a little bit more about the purpose and the goals of the WADA Working Group on doping prevalence?
When the current working group was established, our remit still is, to look existing evidence for doping prevalence, look at existing methodologies that we can use, develop further or modify for that purpose, and potentially develop new methodologies. So we made progress in all fronts. We looked at the available evidence, which we published in 2020. The picture was quite patchy and the available evidence was rather weak and very, very difficult to combine for all sorts of reasons. We also look at potential methodologies, and that's why we opted for the three that I just mentioned to combine. But we also made that realization that we have to find a way to combine the three different level of indicators into one single framework. So this is what we have been working on since 2017 and ongoing, at least in this year. We pretty much finished the survey component. We finished the review, obviously, in 2019. It's very soon will be time to update that. And we still have some work to do on the athlete biological passport data and how we can use that to estimate the prevalence. Again, I have to go back to one step and explain some of the methodologies. The difference between the three components I just mentioned, obviously doping testing and anti-doping rule violations, identify individuals. And then we can calculate the prevalence based on the number of athletes tested or the number of samples analyzed, and then the number of samples turns positive or athletes sanctioned. So those are identifying individuals. But the other two methodology, both the survey and the athlete biological passport, do not have this requirement. We only want to estimate the proportion of athletes or samples that are indicating doping use, but without the need to identify the athletes. So the next challenge then is how we can combine the three different level of data into a single framework. So that's this year's project.
Definitely. So can we talk maybe a little bit more detail about how was WADA's doping prevalence survey tool developed? What was the process or the conversations that went into developing this tool?
Well, it started from the requirements that we should try to find a method that complement the existing ones. So we don't have to reinvent. We already have doping testing. We already have athlete biological passport. We can repurpose the data for prevalence use, but the data are collected as part of the doping control anyway. So the question was, if we are adding a new element to this mix, what that should be. And searching for a method that are both cost effective, can be rolled out at the global level without much extra resources and know-how. The survey was an obvious choice because that's, as I said, it is relatively cheap. Once the survey is implemented, then it doesn't cost much more to sample every single athlete who's in that population. So it can provide a huge amount of data with relative ease. So we opted for the survey, but then the next challenge was, can we find a survey methodology that provide absolute guarantee for the athletes that they are not exposed in any shape or form, so they can be honest if they want to. And one of the methodology, which is not specific to doping, it has been used in researching socially sensitive issues, whether it is drug use or abortion or cheating on the tax or whatever else, anything that people probably not very willing to admit openly. So the methodology exists, it's not new, which is adding a statistical noise to the answer, which means even if I try to, I cannot possibly tell how the athlete answered the question, in this case about doping, on the individual level. But because I know the nature of that noise, I can calculate the proportion of the athletes who actually admitted doping in the survey, which means I can calculate the proportion of athletes who admitted doping for the sample, but I cannot identify the individuals who contribute to that proportion.
Absolutely. So it sounds like it has that layer of anonymity. So that adds a safety component where these athletes know that their results or their answers to this survey cannot possibly be traced back to them, which I think is critical to getting people to answer honestly.
Yes, indeed.
Absolutely. So thinking about this survey, what does it look like for an athlete, or what is their experience as they're completing it? Is it long? Is it short? Is it all online? How does it work?
Well, the length depends on how many questions we ask. For the prevalence survey that we use 5 questions. The first question is pretty much just the warm-up so they understand the format, because you ask how athletes feel about this survey. Admittedly, it's confusing at first because this is the type of survey they've never seen before. And for those who listen to that, it's probably a good idea if they would look at some of the webinars and look at actually how the survey looked like. But basically, the core component is we combine the response to the doping question, which is a yes or no question. We ask, have you used doping in the past 12 months? Not exact wording, but to the essence. But we combine this with a completely unrelated, non-sensitive question. We are not using the birthdays because there are better ways to do that, but it's easier to do with a birthday now. So if you think of your birthday, we didn't meet before. I don't know your birthday at all. So that's the information you know, but I don't. So when I'm asking you if you use doping, let's pretend that you are an athlete. I'm asking you if you use doping, but I'm also asking you at the same time whether your birthday is falling into January, February, or March. So you have 2 questions. Each comes with a yes or no answer. But I'm asking you to tell me whether you have 2 of the same answers or you have 2 different answers. So, or you tell me that you have 2 the same, in which case you can have 2 yes answers or 2 no answers. Or you are telling me that you have 2 different, but I still don't know which one is a yes and which one is a no. That's the format. And that's why it completely protects you, because even if I see your answer, I don't know why you answered that way.
I see.
But when athletes are facing that the first time, and if they never did surveys like that before, they sometimes confused. So why do I have to memorize these numbers? Why you are asking me about the birthday? You
have to understand the statistics behind it a little bit. Yeah.
They don't necessarily have to understand or want to understand the statistics, but it's something that they have never seen before. So for that reason, we have a practice question. And usually after the first question, they started to understand, like all of us, we don't read the instructions carefully.
I'm guilty.
We all are. Athletes are not any different. So usually they started to realize what they need to do after the first question. So we use the first question as a practice question. And then we are asking 4 additional questions that are doping related in increasing sensitivity order. So we are asking whether they provided doping control samples in the past 12 months, whether they use nutritional supplements, again, in the past 12 months, if they used prescription medicine, and whether they use prohibited substances or methods in the past 12 months. So with these 5 questions and a cursory reading of the instructions, the average length is about between 2.5, 3 minutes. So it's relatively fast. It's computerized. So we either use the web-based or we use some tablet computer, or they can do that on their phone, depending on the settings.
Perfect. Well, I think this survey sounds kind of like a quick, in most cases, experience for the athletes. They can provide their information. They may have some confusion about why there's sort of this dual set of questions, but I think it does have this important sort of statistical protection built in to protect their anonymity. And I know athletes contributed to the latest iteration of this doping prevalence survey during the Commonwealth Games last year in Birmingham. So do you have any insights you can share about how this process went?
Well, let me go back to the previous Commonwealth Games, because we have been using the surveys since developing the surveys and continuously improving since 2018, which the first time with this working group, we tested the first variations in the previous Commonwealth Games in Australia at Gold Coast. And then we implemented the survey other major games in 2019, and then in between online and so on and so on. The reason why I said that is because from the beginning, I advocated for including athletes as much as possible. So every single time we implemented the survey, there was a feedback question component at the end. So we asked whether they understood, whether they trusted the methodology, whether they understood how the methodology works. And in case when we had different formats, we asked their prevalence. So from the beginning, I was very keen on developing that survey methodology together with the athletes. it may not be the same athletes who will be affected by, maybe it's the next generation. But I was very keen on taking their feedback into account as much as possible. So I was there at every data collection. I talked to the athletes, I talked to the entourage, I talked to people around that. So I think the current methodology we have is the result of being involved in hands-on experiences. But you asked me about the last Commonwealth Games in Birmingham. So that was the first time when we asked feedback on a questionnaire format as well from the athletes. But together with a colleague of mine, we also invited some of the athletes to do a mini flash interview after they collected, again, about their experiences, their trust, whether they understand, and generally how they felt about the survey. We collected close to 100 interview data based on that. And that was a very, very useful feedback. We are still in the process of analyzing and writing it up for publication. But generally, I can tell you that athletes trusted the methodology without really understanding how it works.
Absolutely. And I think it's great that you're getting that direct feedback from athletes and actually going out there, being on the front lines, having these conversations with people to ensure that they're being included in the development of this tool, because I think that is absolutely critical going forward. And I know you contributed in addition to a subject-wide systematic review paper actually evaluating the scientific evidence related to the prevalence of doping. And this paper came out just a couple of years ago in 2021. So can you tell us a little bit more about sort of what you found as the state of the evidence at that time?
That paper was the first output from the working group when we looked at the literature for any evidence for doping prevalence. And the summary is in that paper. I think generally we found which didn't surprise me at that point is there is no large-scale prevalence study. And that's not surprising because do one is close to impossible for the academics without having access to the athletes, having access to the sport events. So most of the evidence in published scientific literature comes from either reanalyzing doping testing and sanctions, which is useful, but we know the limitations, or came from studies that did not set out to establish prevalence, but they provide enough information to calculate the prevalence for the sample. So mainly I'm talking about research that aim to understand, for example, factors that contribute to doping, so psychological research, in which case the researchers measure attitudes, legitimacy perception, goal orientation, personality, whatever you can think of. But they also ask athletes or the participants to whether they used in the past or currently using doping. So in that case, if they reported the sample size, they ask 150 athletes, and they reported how many of them admitted, we can use that piece of information to calculate the prevalence for that sample. Obviously, these tend to be very, very small samples for the prevalence. So they're talking about a couple hundreds at best. But that's the only evidence available in the scientific literature other than the reanalyzing the testing figures. So what we found is we found about 100 papers, the majority based on self-report surveys like questionnaires. Frustratingly, we could not do anything with that statistically because out of the approximately 90 survey-based studies, there were no two studies that ask doping the same way or refer to the same time period. So it's either doping is not defined at all or it's defined in some different ways. Most of them not defined at all. So it's leaving to the participants to decide what they think doping is. And variably, they ask about current use, past use, last year use, last season, last 3 months, or ever.
Everyone has a different time period. Yeah.
Different time periods. It was absolutely impossible to combine. So the outcome from that review was that the available evidence for doping prevalence is rather weak, and it's a poor quality of data. I must emphasize that it's not referred to the quality of the research that has been done. It's just the poor quality of evidence for doping prevalence.
Absolutely. And you hinted at this sort of frustration with the lack of standardization across studies. And I know in addition to just collecting and synthesizing the results from previous studies, which is a tremendous amount of work in and of itself, you and your colleagues also proposed some actionable, we'll call them best practice recommendations for reporting in future studies. And I think these are critical for moving the field forward. So what were some of the changes, Andrea, that you're hoping to see and how scientists report their work and maybe design their studies on this topic in the future?
Some of the changes relate to implementing a more standardized measure if it makes no difference to their research. So obviously, because the research is not about prevalence, if the last week use of doping is important for their purpose, this is what they have to use. But if it is not important, one recommendation is please use one of the standardized one, whether I ask you current, last 12 months, last 3 months, or lifetime. So at least we can combine at the end. The other recommendation, which probably improved the quality of the research as well, is giving and offering a standard definition of what we mean by doping. Because leaving that interpretation to the athletes, the data we receive is probably, again, all over the place. So that's research design. But the other element, which is not impacting the research design at all, it's just about reporting. We ask, even if it is in the appendix, just please provide enough information that we can extract it later on. Not necessarily we, because maybe 10 years' time, maybe someone else wants to do this review, can extract the information easily. So report sample size, number of dopers admitted within the sample size, possibly the gender breakdown, possibly the level of sport. So just the basic standard information that helps someone else's job easier in the future if they try to extract the information. So it's just a little bit of attention to what is reported.
Absolutely. And I think you brought up a good point earlier when you mentioned that a lot of these studies were relatively small studies. So I think being able to pull the data in these cases is even more critical so that you can kind of get a larger sample that you can start pulling these statistics and the information together across.
Indeed.
Definitely. And I know you and your colleagues also recently published a paper that actually re-examined the estimated prevalence rates for doping at 2 major international sporting events all the way back in 2011. So this, I thought, was a fascinating paper. Can you share why these particular 2 events were chosen for this study?
So the first attempt for establishing doping prevalence and working on doping prevalence with WADA is dated back to 2011, when the first working group for doping prevalence was established. And pretty much the remit was the same. It was a different composition. It was a different group than what it is today. The remit of the group was pretty much the same, looking at the available evidence and developing a new methodology that might be added to the toolbox for establishing doping prevalence or estimating doping prevalence. And we started with a survey methodology, which is not dissimilar to what we have today. And that was implemented and tested in 2 sport events. So the reason for the choice for these 2 events is because at that time, in that particular year, these 2 major events were available to us. The advantage for the Athletic World Championships was it's a multinational sport event in a sport that is prone to doping, so high risk for doping. And the other sport event was the Pan-Arabic Games, again in 2011 in December in Doha. And the advantage there, that was a multi-sport event. So both provided the opportunity to generate large enough sample. We did not talk about that before, but I think it's important also to mention that because of the way the survey methodology works and the way the questions set up, we work on probabilities. So we have to have knowing the distribution of the birthday or a distribution of the probability that the number you picked is coming back, which means we are talking about large scale statistics. So we need large samples. By large, we mean ideally thousands, but really at least a couple hundred to make it reliable. So we were looking at sport events when we have the large sample. And these 2, the Athletic World Championships and the Pan-Arabic Games, were available at that time. We implemented 2 different methodologies, 2 different survey formats. Both work in the same concept of masking the real answer by adding some statistical noise, by adding another question. But the 2 survey formats work in different ways. And the results were surprising. One methodology that was more established version of the survey returned a very high estimation for both events. Don't quote me exactly, but they were very close to 50% for both events, which was surprisingly high.
So what were you thinking? What was going through your head when you saw that 50%-ish number come out of the results?
Well, it's not just that, but because we had the other survey method at the same time was an important issue. So let's say we just have survey A and survey B. They work differently. They all ask about doping prevalence. They try to estimate doping prevalence based on athletes' admission, but work in different ways. In both events, we implemented both methodology in different format. At the Athletic World Championships, we asked every athlete to do both in randomized order. Sometimes they had to do version A first and then B, and vice versa. And in the other event, we randomly split the respondents into two groups, and one group had to do survey A and the other group had to do survey B. But there was no reason to believe that the doping prevalence or the willingness to admit doping prevalence would be different between the groups, because we randomly allocated the athletes to one of the two groups. So one, let's say survey A returned the close to 50% prevalence, which was very high. But survey B returned still high, but definitely lower. So we are talking about high 20s and 10%. So there was a significant difference between the two methodologies. So that was an interesting element. It's not just that we received 50%, but we also received a very contradicting, very different results using a different method at the same time. So, it's like Seagal's law. It's the man with one watch knows what time it is, but man with two watches is never sure. So we were in a situation that, okay, we have two watches and one says 50% and the other says 25. Which one is correct? Mm-hmm. And there was no way to tell which one is correct. So because one methodology was more established, my argument was we need to sit on these results a little bit longer. And we need to have a third study try to understand what's happening, because it's either one of them is right, but we don't know which one, or neither. But we need to understand what's going on. Some of the group members were more excited about the 50%. And it's typical in anti-doping research and publications that there's a belief that the higher must be the more truthful response. So what happened after that is the group collectively decided to write up the paper using survey A, which returned the close to 50% methodology, and submitted for publication. And that was Olympic year. It was 2012. It was exciting, but we didn't get that far because at that time, I think both WADA and possibly the Athletic Federation wanted to have a little bit of time to think about it, how to manage the results when it comes out. So they asked us not to publish the papers. We were under confidentiality agreements. So the only option available to the group was to oblige and sit on it until we get a green light. But somehow the manuscript made its way to the New York Times in 2012. So it was published, not the entire manuscript, but the highlights, the 50%. Mm-hmm. So 2012, New York Times published the highlights of the results, which created a bit of attention, both within the working group and within the community. And we had to shelve the other part, which is survey B, and the results from that until that whole mess cleared up, which was around 2016. There's a lot of coincidences here. I don't know if those who listen to this podcast remember, but there was the time when there were issues around the international athletic federations and some leaked information. I think that was the time when Fancy Bear hacked into the databases and published some of the TV results. So long story short, there was a parliamentary investigation in the UK around that time. So we are talking about 2016. And somehow they got a copy of the manuscript that was prepared back in 2011 and somehow was in circulation. And the UK Parliamentary Committee overnight decided to publish that on their website. So I only find this out when a journalist phoned me and asked me about the paper. And I was really surprised. But sure enough, it was there published in the UK Parliamentary Committee website. And they published that under the Parliamentary Committee privilege because it was in the public interest. So we end up being in a situation when the paper was somehow published but not published. It was publicly available, but only the main text was published, not the appendix where the old calculations and the important bits were. So after that, the working group actually published that study, which came out in 2017, 2018 in full. That actually describes the methodology from survey A, but only briefly mentioned that there was another study. There was another tool that returned a very different prevalence estimation. So the paper that you asked me about is telling the second part of the story. So we analyzed the data that were collected at the same time. So we did not really reanalyze the existing data. We just published the second part of the data. in the paper that came out just a couple of months ago, which essentially challenges the high prevalence, not stating that the second one is correct, but at least putting the question mark over, because now we are in a situation when two survey methodologies provided two very different prevalence estimation for the same population. We cannot tell which one was correct. But the fact that there is such a huge difference between the two suggests that there was something wrong.
Mm-hmm. Or something just that you need to better understand what's happening. And I think that's a big challenge in science more generally, but maybe particularly poignant in anti-doping science, because there's a lot of public interest in this topic and some things are quite controversial, or people get really emotional about some of these things that are coming out, because particularly on the athlete side, this is their career. This is everything that they're dedicating their lives to. So I think it is a big challenge to make sure that the communications are going out in a controlled fashion and to make sure that you can sort of wrap your head around what is happening when you get unexpected data, which it sounds like was the case in this particular research study.
It was definitely, and I'm very happy that we were able to publish the second part, is because now we can ask the scientific community to contribute and looking at it. And it's not about questioning the survey methodology. It's about making sure that the survey methodology works as we planned. So I'm hoping that the outcome from that is not that we said, survey methodology doesn't work. Let's forget this because we cannot get. Yes, we can. We just need to progress very, very carefully and very slowly, crossing all the T's and dotting all the I's. And this is what we have been doing with the prevalence group. So we might not progress as fast as someone might expect us to do, but it is because I learned from the previous one. And this time I'm progressing very, very slowly and very carefully.
Absolutely. Well, I think this is an amazing story, Andrea. I'm glad you shared this with us. And I think it illustrates some of the real world challenges that you have being an anti-doping researcher. You have, like I said, these unexpected results that pop up and you have to manage a lot of different aspects of them, whether it's the media side, the research side, the collaboration side. And I know as an anti-doping scientist, you actually collaborate with quite a few other stakeholders, including funding organizations like the Partnership for Clean Competition, these athlete organizations, these sporting events, and also organizations like WADA. So can you talk about what these collaborations are like and how you interact with these organizations?
I think I have to separate what I do for the prevalence, which is WADA project, if you like. It's under WADA sponsorship, WADA's working group, and what I do in my other life as an independent academic researcher, because the two are quite different. So with the WADA prevalence project, obviously we work through WADA and WADA stakeholders. And yes, I agree. It's both a political minefield, and some organizations are more willing and open to do the prevalence study than others, which is understandable in some way. And I hope that eventually we will be able to convince all the stakeholders that the answer from the prevalence survey might not be exactly what they wanted to see, but ultimately it's important for them to see because that can make their work better in the future. But as I said, it's a hit and miss at the moment. Some organizations are easier to work with than others. I am absolutely privileged and grateful for the opportunities to be there and do that. Something important to me as an academic researcher is the ability to work with and being on the front line. I think this is an experience that benefited my research in every area. As much as we think we understand what's going on in the field from the academic side, unless you are really there, you don't. And this is what I had to come to terms with.
I think you have to sort of have these experiences to appreciate the complexities and the nuances with all of these different collaborators and relationships.
If I'm absolutely honest about my past 20 years, what I thought I understood about doping, and I was working on that for a good decade, what I thought I understand about the doping problem has changed by being on the field, being at these sport events, talking to athletes from all over the world is a very different ballgame than talking to UK or European student athletes and athletes available to us as participants in our environment. So I think that was a very, very good learning experience and an eye-opener, if I can be absolutely honest about this. And I'm very grateful that WADA is opening the door for working at these events and stakeholders. So I hope that I had good relationship with them. I always try to be absolute honest and transparent and involving them in whatever we do, working collaboratively. That's the same ethos as I wanted to do with the athletes, is we are in this together. I need their help and I hope we can come up with something good at the end. You asked me about the other organizations and funding bodies, which is obviously very relevant to what I do as an independent academic when I'm not doing the prevalence project. My interest there is quite different. Lately, I'm focusing on clean athletes and how does it feel like to be a clean athlete in this environment? And what is the clean athlete's life? Because their life is not that easy. They have to comply with the same rules and regulations, understandably, and they do that. But what they say is being a clean athlete it comes naturally to them and it's easy for them, but complying with all the rules and regulation is not. And there isn't much support at the moment for them from the anti-doping organizations because they are the non-problematic ones. So that's a very different part of my research. So far, I receive fundings from the IOC, we receive fundings from the European Union, I receive fundings and benefited fundings from WADA. PCC, not yet. So I need PCC for my Grand Slam. Hint. No, I think the challenge there really is coming up with projects that all of these organizations want, which tend to be problem-focused and solution-focused, which is understandable. PCC is funding research that makes anti-doping better. WADA is funding social science projects that provide a solution, which is important and understandable. But at the same time, I think we are talking about anti-doping community and researchers community. We need research that is actually going back to the basics and start questioning notions that we take it for granted and we think we understand. Finding funding for that one is quite challenging. So what I mean by this, we all talk about clean sport. We talk about the role of the values. The problem with social science is we think we understand what we are talking about because these are everyday terminology. Of course, we understand what clean is. Of course, we understand what values are because we understand the word. But do we understand the same level as is needed for research? To give you an example, one of the projects that we had was still ongoing with the different groups, but so far we published 2 papers from that, is we actually ask athletes what clean sport means to them. Because we all talk about clean sport, but do we actually have an understanding, okay, what is the operational definition of clean sport? And not surprisingly, athletes had a difficult time to try to find a definition. We can all come up with plenty of examples what not clean sport is. It's like defining health. What is health? Health is the absence of a disease. So clean sport is then if there is no cheating, if there is no doping. So we define clean by ruling out what is not clean. The reason why I use that example is because we take it for granted that we understand this. We understand what values are. We think we understand how values work. But if we go back to the basics and we ask athletes about really listening in deep conversations of how their values actually operate in daily decisions, it's turned out to be that the picture is a lot more complex than what it is. I think it's important now for anti-doping research to go back to the basics and start questioning these notions that we took it for granted. Let's start questioning what we actually mean by attitude, because it's a very broad concept. Do we actually need to keep chasing attitudes or something else is more important? How values work, what clean sport means. And even if we understand and agree what clean sport means, what is acceptable clean performance enhancement? And athletes agreed in our research, athletes agreed pretty much on what clean sport is, which is cheating-free sport, if I try to simplify it. And they pretty much agreed. But when we start talking about what is acceptable clean performance enhancement to them, their positions varied very, very widely. For some, that by not using anything unless it's for health reasons. For others, using anything that is not prohibited. Why is it important? Is because when it comes to anti-doping education, where you position yourself in this clean spectrum actually presents very different levels of vulnerability. So I think after 20 years or 20 some years now, anti-doping social science research, I'm talking about social science, only the behavioral side, get to the maturity where we need to go back and be a bit more scientific about what we try to measure and try to assess. It's understandable that the way we started, when I started my PhD in 2000, there was no attitude measure. There was nothing. So we had to create something. We had to start with something because something was better than nothing. But I think now it's time to go back and revisit some of these assumptions that we had and do a little bit better.
Absolutely. Well, I appreciate you sharing these insights. And perhaps that was a perfect segue into our next question, which is thinking about if you were able to answer any of these questions, maybe take it back to the basics even. If we gave you all of the resources you might need, whether that's funding, staff, technology, time, Andrea, is there one particular problem in anti-doping that you would want to solve most?
I really wish that the whole prevalence issue and the prevalence program will be elevated to the level where it should be, whether it is within WADA or somewhere else. But I think because of the level of resources needed and because of the coordination needed to make it global, it has to be coordinated from somewhere in the top and somewhere who can put resources behind that. So my dream is start with the global survey. I have a global estimation for the prevalence using all indicators that we have and we just talked about, and have one baseline to try to understand where we are and then implement the prevalence estimation as an ongoing. So my dream is that it would be something like the census. We don't particularly enjoy that, but we know it's coming.
Absolutely. I really like how you drew the analogy to the census. It's something that allows us to take a step back and get that big picture view, but it doesn't really have the sort of emotional charged or political implications, et cetera, that you might get if it's coming from a particular organization. You worry about what the agenda would be, but no one really has those concerns when it comes to something like the census.
This is what I would like.
Well, Andrea, thank you for dreaming big with us and giving me and our listeners a lot to think about in our conversation today. If our listeners are interested and they want to learn more about you and the amazing work that you're doing, not just in the world of prevalence, but across a variety of different topics in anti-doping, what is the best way for them to do so?
We try to publish, or I try to publish everything or make it in the public domain in some shape or form. It's not necessarily publications, but sometimes these are videos and sometimes the case studies and whichever format. We try to make it publicly available. I think the best one is finding my university webpage, which is relatively easy. You just Google my name and Kingston University. And I have the collection of all my publications and all the other case studies or other pages linked to that. So probably it's a good starting point. Alternative is my email is open. So anytime feel free to send me an email. It's a.petroczi@kingston.ac.uk.
Perfect. Well, thank you for sharing those resources. Listeners, definitely check out the website, learn more about Andrea and the wonderful work she's doing. And Andrea, it's been such a pleasure to have you here with us today. Thank you so much for sharing your time and your insights with us.
Thank you for having me.
Well, it has been a pleasure. Listeners, wonderful as always to have you here with us as well. If you haven't already, it would mean so much to us at the PCC if you could rate our podcast and leave a review on your favorite podcast platform. And listeners, please note that the Anti-Doping Podcast features a wide variety of clean sport experts, and episodes may include statements and or viewpoints that do not necessarily reflect the views or values of the PCC. Thank you, and we look forward to seeing you on the next episode of the Anti-Doping Podcast.